It's so important that we have accessible, quality healthcare when it comes to HIV and HIV prevention. And the services offered by the Hub El Centro are amazing.
The Hub is a safe place for me to just come get tested, more information about, HIV, STIs, be a part of the community, be among other people who I can relate to.
Recently, I became a patient here. I switched from the clinic I was going to, mainly based off of their hours. They're much more flexible. I love it here. I love the people here. They're very friendly.
You can come in and not really feel judged about your background, who you are, and your the things that you enjoy doing or whatever. You just don't feel judged to come in and talk about your sexual health.
They're free services. A lot of times we don't have money. We don't have access to the healthcare the way that we need or the resources. But in this one place, the Hub, El Centro, you have everything you need.
Maybe having some technical difficulties with Kathie with the audio there. So we're going to give you a chance to test that out. And Adaris, if you want to jump right on in.
Sure. Can you guys hear me? Okay. Awesome. Well, we're so excited to have everyone here for our town hall, just talking about the federal impacts and things like that. As of 2025, there are more than 16,000 people in Alabama living with HIV. Over the average cost of someone's lifetime, it'll be around $554,000 to treat their infection. In 2022, 72,704 HIV tests were provided in Alabama with CDC funding. So that funding is vital for people with HIV in Alabama to get the healthcare that they need and deserve.
So can you guys hear me now?
Yes, we can.
All right. Well, I know Darius welcomed you, but I'd also like to say welcome to all of you. We're so glad that you could join us today. It's really hard to believe that the first AIDS case in America was June 1981, almost 45 years ago. The HIV community has so many brilliant, unique, resilient people that have accomplished really miraculous progress in this disease. And Birmingham's been a very important part of that progress. From the very beginning, the incredible Dr. Mike Sagg and his team at UAB have been leaders in world research. And I think the AIDS Alabama model which is, to my knowledge, the only AIDS service organization in the country that covers an entire state, has been a really great model as an agency that serves both rural and urban areas. Because I've always joked it doesn't matter whether you live in Pineapple, Alabama or Birmingham, Alabama, you should be able to get services if you need them. So, we've come so far. HIV is a manageable disease now. People can live long, healthy lives. And we also know that if a person can take their meds and adhere to them and get what's called a suppressed viral load, which means very little virus in the blood, then they become untransmittable, especially to others, their sexual partners. And so we call this undetectable equals untransmittable, or U equals U. And so, just looking at where we started and where we've come, it really is miraculous. So let me tell you a little bit about AIDS Alabama. We devote our energy and resources statewide to helping people with HIV to live healthy, independent lives, and we work to prevent the spread of HIV. Now, I will say that a few years ago, our board decided to broaden our mission a bit because we know that lots of other folks are at risk for HIV, particularly in the homeless community. We know that homeless people are 3 times more likely to end up with HIV than people who have stable housing. So we have some of our programs that have broadened to beyond just HIV. HIV will always be my mission. And in Alabama, unfortunately, we still have 16,000 people living with HIV. And I know Adaris mentioned this, but I think most people don't realize how expensive HIV can be. We spend $554,000 per case in the United States in lifetime medical costs. So just averting one infection saves that much money, which is just astounding if you add it up. In 2022, which is the latest stats we have, the state of Alabama provided more than almost 73,000 HIV tests with CDC funding. So in America, in the United States, more than 65% of the 1.2 million people living with HIV now have a suppressed viral load. That's just incredible. We want to get that number up to much higher, 90% hopefully, but 65% of the people in the United States are virally suppressed. In Alabama, however, that number is only just over 54%. So we still have a good bit of work to do here in Alabama. We have the 10th highest rate of HIV diagnosis in the nation. Alabama had more than 500 new cases last year, and thus far this year we have 237 new cases. We also do a lot of housing at AIDS Alabama, and you might say, what's the link there between housing and HIV? Why have special funding for housing for HIV? Well, there are several reasons. One is that it's a transmittable disease, but also there's still a lot of stigma around HIV. And we know that to be the case, and we're trying very hard to minimize that, but that's just the reality that we live with. And with housing, we know that we, number one, improve medical outcomes. Number two, it's a prevention mechanism because people who have a safe, decent, affordable place to live and sleep and eat don't necessarily participate in activities that could lead to transmission. And finally, we know that it's cost effective. So just last year in Alabama, almost 1,600 people accessed services through our HOPWA grants with the city and the state. We linked 467 people to housing information to try to help them find places to live. And 321 at-risk persons were provided with additional housing information. That's a lot of folks that need housing. And I can tell you that we don't always have adequate housing stock to serve everyone. But look at the transportation. We all hear about transportation in the South, right? It's not great. But we provided almost 19,000 transports to almost 5,000 Alabamians last year. So that's a very important part of what we do. And then case management. We want to look at the whole person. HIV may not be their top problem. So our case managers and social workers are really awesome. And we provided over 17,000 instances of case management services last year. Now, one thing that's really unique about Alabama is the group we call ASONA, the AIDS Service Organization Network of Alabama. So we are all connected with each other, and we meet with each other, we eat with each other, we know each other, and we have managed to cover all 67 counties in Alabama. This is a very unusual model. In some counties where you see the stripes, there may be 2 organizations that cover that county. But you know what? If I bump into you doing prevention education in a county that we also work in, all I have to say is, yay, we could never have too much prevention education. So I just think that this model should be adopted by other states, because when you look particularly at the South, there are lots of states that just have one major urban area, and then the rest of the state is pretty much rural. Atlanta and Georgia, New Orleans and Louisiana, Jackson and Mississippi, for example. So through this methodology, we've been able to cover all 67 counties. These are some of the programs that we have at AIDS Alabama. You may have seen the ad at the beginning for El Centro, the hub, which is our drop-in center. You can go there and get help with your resume, wash your clothes, take a shower, get an HIV test, get HIV treatment. The hub is a wonderful space, and we're so glad that so many people are utilizing it. The Living Well Health Clinic there in the same building provides testing and treatment, PrEP services. So we do a lot of test and treat out of our Living Well Health Clinic. The Living Well Outpatient Center is a mental health center certified by the Alabama Department of Mental Health, and we do individual and group therapy there. The Way Station is our newest facility. We have 20 emergency beds for homeless persons and 20 transitional beds where you can stay longer, get a hot meal and a to-go breakfast every day if you need it, and we will provide you with the services that you need. Our Housing Assistance Fund is part of our statewide rental assistance, and through that we are able to provide assistance to keep people housed. Enroll Alabama is our program to get any Alabamian into healthcare, particularly the Affordable Care Act or Medicaid or CHIP. We want our folks in Alabama to have healthcare coverage. The Alabama Rural AIDS Project we've been doing for many years. It's rural outreach and housing assistance in some of our poorest, ruralist counties in Alabama. LibCap is an intensive outpatient program for substance use. CALA is our outreach program for our Latine community. We provide linkage and retention, financial assistance, support groups, and lots more. And then Shell Health, we're very proud of Shell Health. That's our clinic down in Mobile, Alabama. We have more than 1,700 active patients there, and they do a really great job in a stigma-free environment. So HIV housing in Alabama, the rent keeps going up, but the number of affordable units is not necessarily going up at the same pace. As you can see, we provided a lot of households with what we call TBRA, which is long-term rental assistance for a person living with HIV and their families. And then another 235 were provided with short-term rental assistance. So that was last year. Look at this year. We already have almost as many long-term clients as we had the entire year last year. So the need is only growing, unfortunately. So let me tell you about a few of our specific programs. We like to say that we have a continuum of care and housing at AIDS Alabama, everything from emergency housing to transitional housing to permanent housing to service enriched permanent housing. So the first of our programs here are what are called 811 programs. They're housing for people with disabilities. As long as we can keep them filled with people living with HIV, then that's the disability that we're utilizing. These are the Mustard Seed, Agape House, Agape 2, and Magnolia Place in Mobile. The Rectory Shelter is a 12-bed program that's a substance use program. We also have one emergency bed in there, but folks must participate in our Living in Balance chemical program. And, you know, I can't stress enough how many people living with HIV also have mental health or substance use issues. Jasper House, we're so proud of. It's the only facility in the state that's for people with an HIV diagnosis and a severe mental health diagnosis. We take referrals from across the state. We're approved by the Alabama Department of Mental Health, and we have 14 beds in this program with 24-hour supervision, a licensed nurse practitioner, and a psychiatrist as our medical director. And our continuum of care housing. These are programs for the homeless in the Birmingham area. So the Way Station is part of our emergency shelter program. We also have what's called rapid rehousing. We get folks into the housing, and that's for 12 to 18 months, and we wrap around the services that we need. And as you can see, we've provided a lot of nights of housing. Now, our current federal funding sources, I have to admit, the loss of federal funding scares me. We have an almost $22 million budget, but about 75% of our funding is federal. So we cannot afford to lose those programs, or we're going to see the progress that we've made in HIV rolled back. We're going to see more homeless folks. So we've got to do everything that we can to hang on to this funding to continue to provide these services. This is just some of our federal, mostly federal revenue. As you can see, we have lots of different grants, lots of different partners. I do have to brag on UAB. They've been really great partners in both our housing and food programs. So, you know, that's just some of our grants. We're good at piecing together different kinds of funding to make things work. For example, at the Way Station, we really don't have dedicated funding that covers all of the expenses at the Way Station, as you can imagine, with 40 beds. So we, you know, piece together different grants, a little bit of HOPL money, a little bit of Ryan White money, a little bit of mental health money, anything we can do to piece it together. One thing I'm really proud of at AIDS Alabama is we share the wealth. We're the only agency in the state that provides funding to all of the other agencies. So these are just some of the agencies that we help to support, and we provide about $3 million a year to all of these other agencies. And we're glad to do it. So the last thing I want to talk before I turn it over, the last thing I'd like to talk about is a recent executive order on homelessness. So I'm hoping that slide pops up in a moment. There we go. So on July 24th, another executive order came out on homelessness. And it really has alarmed those of us who work in the homeless communities. It is moving away from the HUD housing first philosophy, which is to get people into housing and then wrap the services around them that they need to help them to succeed. It also promotes institutionalization of folks with mental illness, homeless folks, and it eliminates a lot of the privacy protections that homeless people have. So we're very concerned about this executive order because I don't think it's based in research. And, you know, I think that the approaches that we have been taking do work. We just don't have enough resources and enough housing to put people into. But we'll talk some more about that in a bit. Now I'd like to introduce my two co-directors of advocacy at AIDS Alabama, and they're two very brilliant young people that I'm very proud to have on staff. We have Elizabeth Torrance and Adaris May, and they'll tell you a little bit more about themselves. So Elizabeth and Adaris, if you guys will take it away.
Thank you so much.
Absolutely. Good evening, everyone. My name is Elizabeth Torrance, and I am the policy co-director of policy and advocacy, and I focus more on the federal side.
Yeah, and I am the co-director of policy and advocacy. I focus more on state and regional efforts.
Okay, so tonight we are going to jump right in and we're going to talk mainly about three really big bills that we've been watching on the federal landscape recently. And so all three of these bills could directly affect the work that we do here at AIDS Alabama and in Alabama. So the first that we're going to talk about is the reconciliation bill. And then we'll move on to the recessions package and then also to the president's proposal of his budget. So first, the reconciliation bill, which is also known as the Big Beautiful Bill by some of its supporters, it is essentially Congress's budget cutter bill, and it's a really huge scope of a bill. So we're going to break down just a little bit, very briefly, about what it could actually touch for AIDS Alabama and for Alabama as a whole. And so it touches almost every area that we work in, and that's including healthcare, nutrition, and even education. So first, we definitely want to talk about just the way that it will change the way the government is financed. It adds about $2.6 trillion to the national deficit, and it also extends some tax cuts. And this includes tax cuts from the top and the bottom of the tax brackets, and all of those will be affected. So not just the top, but also at the bottom as well. It, in fact, actually slashes about $800 billion from Medicaid over the next 10 years. And Medicaid, if you did not know, is the largest provider of HIV care in the US. And even though Alabama hasn't expanded Medicaid, these cuts could still affect us because they will reduce funding to the hospitals and clinics that are across the state. It also includes border security and defense spending, and about 9 million individuals will lose healthcare coverage. And 5.2 million of those individuals will actually lose coverage because of the work requirements that will be in place. About 40% of HIV or positive individuals actually get their coverage from Medicaid. So as we move on, talking about the reconciliation bill, we will also see about $300 billion cut from the SNAP program, which is the food assistance program that we have here. Also, more than 2 million households will lose benefits, and that includes about 200,000 legal immigrants in America as well, who has 50,000 children in those households. So that's about 200,000 legal immigrants that will lose SNAP benefits. That includes about 50,000 children that are in their care. This also prohibits gender-affirming care for any age, and also abortion entities if they receive any type of federal funding. So this imposes new bans on federal funding for abortion and abortion-related care nationwide. It also disproportionately impacts low-income women, women of color, and those who are already facing other barriers. It also removes protections for the ACA coverage, things like mental health care, substance use treatment, and prescription drugs. And without these requirements, insurers could essentially go back to selling junk plans that don't actually cover what people need them to cover. So this includes things, like I said, mental health care, as well as other specialists as well. And then the one thing that I definitely want to just highlight in this section is that there's something that many people are not aware of, and it's called the pay-go law. And it kind of works like a trigger law. So if the debt ceiling is hit, it automatically forces up to $500 billion in Medicare cuts. And this puts seniors and individuals with disabilities at serious risk. And although these cuts strip away the safety net that most Americans rely on and thousands of Alabamians, this for our clients means less food, less healthcare, and more barriers to a stable and healthy life.
Awesome. And the next piece of legislation that we have is the rescission package. So this bill essentially revoked $9 billion of funding that was previously approved by Congress in the last budget cycle. That was cut by the Department of Government Efficiency, formerly led by Elon Musk. The elimination of CPB funding, which was about $1.1 billion. It also rescinded federal funding for the Corporation for Public Broadcasting, effectively ending federal support for NPR and PBS. Also, around $7.9 billion of foreign aid cuts, many of it to PEPFAR. And then in the president's proposed budget, he proposed that we eliminate all CDC funding for HIV prevention, eliminating HAPWA, housing for persons with AIDS, and reducing homelessness funding, and combining all of our homelessness programs into emergency solutions grants with about a 24 max assistance, and then cut them by $532 million. On other things, it moved all STI and Hep C work and then some mental health funds to block grants that will be run by the states, which could lead to more cuts in the state of Alabama. It also eliminated Ryan White Part F, which includes dental and training centers, as well as cutting NIH research grants by around 43%, from $11.6 billion to $15.1 billion.
So now we're going to move into the Senate bill markup that we have so far. And this is from the Health and Human Services Senate Committee. And so I'm going to go through some top line numbers for you first, and then I'll tell you where the bill is. So right now we have the Senate Committee markup, and this is right now as it stands, it is $2.571 billion for the Ryan White HIV services program. And so right now that means it's going to be level funded. And this includes all of Part F, which is that dental and the education part of Ryan White. And then also we have $1.38 billion for the CDC National Center of HIV, viral hepatitis, and sexually transmitted diseases and tuberculosis prevention. So essentially, this is now level funded for all divisions, except for a $10 million cut to the Division of STD prevention. Also, we have about $56 million for the Secretary Minority HIV/AIDS Fund, which unfortunately means that we got a $4 million decrease in this Minority AIDS Fund. And then lastly, I'm going to highlight that there will be $157.3 million for EHE funding, which stands for Ending the HIV Epidemic, PrEP funding. And PrEP stands for pre-exposure prophylaxis. And so this is something that we use for prevention methods for individuals. And right now, this is at level funding. So right now, the Senate bill awaits for a full floor vote, and the House is still pending. Right now, they're in a recess, so we won't see anything happening with this bill until September.
Next slide, I guess.
Yep, we're going to shift it back to you, Ms. Kathie.
Oh, okay. So I think we skipped a few slides here. Did we mean to?
It should.
Right there. See that?
Darius?
Yeah.
Darius, this was you.
So yeah, the impact on rural health. So a lot of recent hospital closures across Alabama have raised significant concerns about the access to health in rural communities. Facilities such as North Baldwin Infirmary and Bay Minette Lake Martin Community Hospital in Dadeville have shut down, alongside others like Crenshaw Community Hospital in Laverne, Bullitt County Hospital in Union Springs. With new federal cuts, more than 130,000 Alabamians could lose healthcare coverage. With 10 rural hospitals closing last year, we have about 25 rural hospitals in immediate danger of closing right now today.
So that leads me to talk about Enroll Alabama. So Enroll Alabama is our state program. We cover all 67 counties in Alabama. And as of right now, we're standing to lose 90% of our funding for year 2. So originally, beginning of last year, we had a 5-year grant that would be funding at a total of $3 million each year. And we received notice earlier this year, around February, and then final markup around May, saying that our funding would be cut for 90% for year 2. So we're still not sure about year 3, 4, and 5 yet, but we know going into year 2, which will start in the end of August, beginning of September, that our new budget will be $300,000. So this cut of our staff would also go from 26 navigators around the state of Alabama to 3 navigators. And those 3 navigators will be in Mobile, Huntsville, and then, of course, Birmingham. And then I'll also want to just mention that the impacts of cuts for our navigator program. So not only does these cuts impact our navigators who also live in the same communities that they serve, these professionals do a lot more than just paperwork. They build trust with their community. A lot of our clients, they come back year after year. They might be older or have less literacy than others. And so it's very important that they trust us. And so, during these times that we have cuts, this is very comforting that if we have these individuals in place, because it's very times of uncertainty. And help of these navigators, they really help our clients to be able to feel comfortable to not only be able to ask questions from year to year, and also they get help during special enrollments periods as well. So losing these roles not only affect employment for our navigators, but they also remove critical emotional support from already vulnerable communities in Alabama.
So I'll talk just a little bit about the federal program cuts. Little summary here. It often helps me to hear something twice. So Medicaid, we know that these huge cuts that have already been passed in the one big beautiful bill are going to cause, I've heard different estimates, up to millions. We've heard from 9 million to 16 million people are going to lose their health care. And, keep in mind that nationally, 40% of all HIV medical care is covered by Medicaid, and it also covers 60% of senior care. So there are a lot of folks, grandmamas and granddaddies, that are going to be impacted by this change. The second piece, Medicare, is something that a lot of people don't realize, that there's a law on the books that if our national deficit reaches a certain point, then we have to cut Medicare. We all know that Medicare is what keeps our seniors going in the United States. And the thought of losing $500 billion in Medicare because of our deficit is definitely scary. SNAP, food, how do you get more basic than that for low-income folks and children who are going to be hungry because they lose these benefits? For the HIV/AIDS domestic programs, right now we still have more questions than we have answers, but we do know that our research has already been decimated. We know that the scientific programs at the CDC have been torn apart. What we don't know yet is exactly how much money cuts are going to go with these changes. And then finally, I have to say the loss of PEPFAR and USAID is just heartbreaking. This was the most significant piece of legislation under President George W. Bush. He's very proud of the legacy of this program, and well, he should be, as it has saved more than 20 billion. So this is just devastating that program is being torn apart.
So now we're going to step into our advocacy hat. We talked about a lot about policy. And so now we really want to uplift what some of our national partners and some of our Alabama partners as well that we're doing in our advocacy world. So one of my favorite things, of course, would just be AIDS Watch. AIDS Watch this past year, we talked to there was over 630 advocates from 38 states on Capitol Hill. There were about 271 meetings with members of Congress. And for Alabama, we actually met with about 90% of our federal lawmakers, which is really amazing. We were able to have face-to-face conversations with them and tell them how bad this would be for Alabamians and put a really human face on the data that they see all the time. And so these personal stories are critical for making policymakers understand what's really at stake for us.
And another crucial and important part about to our work to end the HIV epidemic is evangelical and faith voices. Christian evangelical groups are publicly urging the Trump administration to fully fund programs like PEPFAR and spotlighting the devastating consequences that these cuts could have across the globe.
And speaking of PEPFAR, and this is also known as President's Emergency Plan for AIDS Relief. So for years now, advocates have been used, and PEPFAR has been used to save over 25 million lives globally. And so right now we have a lot of protest of action, even so that at the State Department, some PEPFAR protests actually stacked about 200 symbolic coffins to really protest against the cuts to PEPFAR and highlights how many lives were really at risk.
And another crucial part of our coalition are corporate and business advocacy. Gilead Sciences and the U.S. Business Action to End HIV Coalition have been lobbying lawmakers to maintain federal support for HIV prevention, treatment, and research, as much of this has led to other scientific breakthroughs, such as the mRNA vaccine.
Absolutely. And then we also just want to lift up one of our national partners, as well as some others. And so they had some legal challenges and the San Francisco AIDS Foundation, along with several other partners, filed a federal lawsuit challenging President Trump's executive orders that restricted grant eligibility. And they actually won a preliminary injunction against censorship based upon funding restrictions.
And of course, our AHAP, our Alabama HIV/AIDS Policy Partnership here at home. Through our Policy and Advocacy Department here at AIDS Alabama, we actively engage with local, state, and federal lawmakers to mobilize demonstrations, encourage civic actions, emails, calls, letters to elected officials. But of course, our annual HIV Advocacy Day in Montgomery, where we just this past year brought over 100 advocates to talk directly to their lawmakers, to their representatives, to talk about why HIV funding is so important at the state level, but also the federal level.
And then turning over to some foundations, some really big foundations, the Gates Foundations actually intervened, and Bill Gates himself met with the senior administration and congressional leaders, urging them to not abandon global health programs, which included HIV and AIDS funding, emphasizing that private foundations can't fill the gap by themselves and that they need federal backing.
And of course, the Save HIV Coalition, a group of AIDS service organizations across the country, have been convening weekly to discuss advocacy strategies and federal updates on the ever-changing HIV funding landscape, but to make sure that all of us are ready to advocate and prove why we need the funding and talk about the communities that we serve.
And lastly, I also just wanted to highlight that us here in Alabama, we're also doing some really good on-the-ground advocacy work. A lot of our friends, even at Cover Alabama, and some other friends as well, they're putting together a petition that we send out. There's also a lot of actions alerts that you'll find on our advocacy page that we send out on our Instagrams. And this is about, calling your congressman or your congresswoman and letting them know that you care about these issues and these are things that are going to affect you as well. So anytime you see any type of advocacy, please encourage others as well as yourself to reach out, because we need everybody's voice to really make a difference.
Okay, and just one more plug. If you are an organization and you're interested in federal HIV policy, join the Federal AIDS Policy Partnership. And if you'd like to know how to do that, I can guide you in the right direction. We'd love to have you join. The more, the merrier, as far as I'm concerned. So AIDS Alabama will be 40 years old next year. I can hardly believe it. But I want to promise you that we intend to move forward with our efforts to end HIV as an epidemic and to continue to take care of people living with HIV. We will not allow 45 years of progress to be undermined. So I will admit to you that this has always been personal for me. I lost my best friend in 1996, just before the good medications became widely available. And I lost another dear pal from college in 2007 when access to his medications were cut off because of political decisions. So we are here. We're going to keep fighting. And we appreciate you joining us this evening. And we want to open it up for some Q&A.
And I think we have a few in the chat already. So I'll read the
Great.
question and then we can go from there. So
Okay.
this is a question from Facebook. Since the Navigator funding has been cut, is the program still statewide? And I guess I'll answer that question. Absolutely. Yes, the program is still statewide. Although, we're going from 26 navigators to 3, and essentially AIDS Alabama will be funding those 3 through Enroll Alabama. We'll have them in Mobile, Huntsville, and of course, Birmingham. But we also have some really good partners, and they have expressed that they will actually still have navigators in their areas. And so that's still a working partnership that we're working on right now. But they will still be available. I know we still have some in Tuscaloosa, and I know that we also are working on one in Montgomery as well as Florence. And then I think we'll have an extra one in Mobile as well. So although, some of the funding has been cut, the work does not stop. And our navigators are really, really, really integrated into the community, and they're still going to do the work. And then let's see. Did anyone want to add anything to that before I move to the next question? Okay. Let's see. Another question from Facebook. Does this affect HIV testing?
There have been some state changes around HIV testing. Darius, do you know what those are?
We don't have anything that I am super aware of. I think we have a few things that may be affected funding, but I think we're set right now.
Okay. So again, it's best for us to know our status. So hopefully, the thing I worry about is if the CDC funding gets cut off, then that's the money for HIV testing. But I can promise you, we will keep testing and we'll find some way to buy those tests.
I think that's a question that actually just did come in. Do the threats to the CDC funding affect our state dollars? And the answer to that question is yes.
That's a big yes, because we get 2 different types of prevention funding from the CDC that runs through the Alabama Department of Public Health. One is the Ending the HIV Epidemic funding, and the other is what they call the health department's flagship funding. It's funding that the health departments all across the country get every year. It's how they are able to have disease intervention specialists and any HIV related programming that they have, and money that they share with the providers on the ground like us. So we would lose 2 different sources of funding if that CDC money went away.
Okay. Okay. How can we donate and support the work you all do? Great question.
We love that question. So I think Gina is going to come on in a minute and tell you how you can donate. So we'll answer that question for you in a moment.
All right. Let's see. Another question is from a landlord in Russell County. Okay. How will the changes impact ARAP housing assistance?
So ARAP, if you recall, is our Alabama Rural AIDS Project. So those are some of the poorest as far as income counties and very rural. And I'll just be honest with you, if we lose rental assistance funding in various programs, that also means the landlords lose funding. So that's a reality. Fortunately, our Alabama Rural AIDS Project grant is in the process of being renewed right now, so I don't think we'll lose that currently. But that's something that we all need to think about. Just like with SNAP, when the food is no longer being distributed, that means farmers and grocers lose money. Well, as rental assistance ends, so will landlords lose money. Hopefully that won't happen, but that's what we're all worried about.
Okay. I see another question in the chat. It says, how will federal changes impact funding AIDS Alabama receives from grants? And also, how will these changes impact Ryan White funds and employment here at AIDS Alabama? So we had a long question.
That must be from one of our employees.
I think so.
So I'm happy to say that the one piece of HIV federal funding that really has not been targeted, with a little exception, is Ryan White. So we know that Ryan White is going to be funded. The only part of it that has been targeted is dental, which puzzles me because dental health is so important to a person living with HIV. So to eliminate the dental services seems very counterintuitive. I don't get it. And the only other piece of Ryan White that's been targeted are the training centers. That puzzles me too, because we all need to stay up to date on training. Social workers need to stay up to date on training. So, I don't quite understand why those two were picked in the president's budget to eliminate, but hopefully that won't come to pass. So I feel pretty good about Ryan White funding. Most worried about prevention funding. That's the one that I am absolutely the most worried about. And of course, housing. But fortunately, we've seen both the House and the Senate in their markups have put HOPWA back in. So they did not adhere to the president's budget. They put HOPWA back in. There are cuts coming for homelessness in general. And we have a huge homeless problem in Birmingham. So that concerns me. And we're not the only place that has that problem. So the answer to that, I don't think, is that executive order where we arrest people and institutionalize them. So just a lot of questions yet to be answered. Any other questions, Elizabeth?
Yes. It says, well, kind of you've already answered just a little bit. It says, I want to know about the housing market and how federal changes will impact AIDS Alabama's housing.
One thing we struggle with, well, a couple things we struggle with. First, there's not enough housing for low-income renters. There's never enough. That's why we have developed the housing that we have developed. So that's problematic. The only answer to that is for us to develop more housing that people can afford. And there's a wonderful organization that puts out a report every year called Out of Reach. And it's how much money you need to make in any given city to be able to afford a 1-bedroom apartment. And it's astonishing. In a lot of cities, you would have to work 2.5 full-time jobs to even be able to afford a 1-bedroom apartment. So there's something wrong here in that the rents keep going up and the salaries aren't keeping pace, and certainly the housing stock is not keeping pace. So these are all concerns that we're working on. One way that we have tried to deal with it at AIDS Alabama is to develop housing. We own over 100 units on the way station. So, we're doing a good job with that, but we need more. And I see that Caroline asked about any word on the COC funding. So let me answer that. That's being targeted as well. The homeless funding is looking at a big cut in the budgets. So we don't know yet exactly how much that will be. But for example, we were planning on working with the city on the new youth demonstration project. That was pulled. And now it may be back in, but it may be in a much smaller status. So these changes are yet to come about, but we're looking at, I think it was 532, trying to remember, would that be million or billion? It's a lot of money that they're talking about cutting from the homeless programming. So that's very concerning.
I see another question here. It says, can Enroll Alabama navigators attend events to help sign folks up? Yes. Plainly stating, yes, that is something that we strive to do. I can't tell you how many events we have. We actually have one this Thursday and one next Monday and one the following Thursday as well. So we are always looking for events to come and just share what Enroll Alabama is, number one, and number two, try to get as many people into ACA coverage and marketplace that we can. And so that's one of the big things that we really need is the word out, because people do qualify, and even if they don't, we actually also help with Medicaid applications as well as CHIP applications. Let's see if we have any more questions.
Awesome. I don't see any.
Well, let me say thanks to all the people who have thanked us, Rodney, Michael, all of you. We appreciate your support so much. Couldn't do this without our folks, supporting us. So thank you. Gina, you want to do more?
Sure. And can everyone hear me okay?
Absolutely.
Awesome. Thank you all so much.
Looks like she's trying to tune in.
We're really grateful for all the information that you've given us. A lot of people have been very scared and afraid and confused, and you guys are the experts. You have the answers. So thank you for taking the time to give us all this information tonight.
Are you going to tell folks how they can donate?
I absolutely will. I'm going to send you guys off. So yeah, thanks everyone for joining us tonight. We're honored to have had every one of you stakeholders, dedicated staff members, community partners, consumers, concerned residents, and elected officials. Thank you all for joining us tonight. Your participation in this critical conversation really demonstrates the strength of our shared commitment to the communities that we serve. And the challenges that we discussed require all of us working together. So remember that you can be a part of the solution, everyone listening, and you can share that empowerment with your friends and your relatives, whether it's through making a contribution to AIDS Alabama or becoming a volunteer ambassador with us or joining our advocacy team's efforts. You can find meaningful ways to get involved on our website, aidsalabama.org, and that's where you can learn how you can join us and help make a difference. Together, we truly believe that we can ensure essential services to continue for the thousands of people here in Alabama who depend on them. We're really grateful to you. Thank you all so much, and good night.